Gateway to Hope is an organization that arranges care for individuals with breast cancer who are uninsured or underinsured and who don't meet the federal guidelines for any of their programs or the state guidelines for their programs. Basically, it's the people that make too much money to be on Medicaid and aren't old enough to be on Medicare. So these are the people that are working, that are trying to put food on the table for their families, and they can't afford to buy insurance. Or they have insurance and it doesn't cover a particular part of their treatment. Some won't cover the chemotherapy, some won't cover radiation. Believe it or not, I have one person that has insurance and it covers nothing. No chemo, no surgery, no radiation. And of course then we have to ask, what kind of insurance is this? And so we set them up with, we arranged care with different providers in our network. And these guys and women are wonderful, these men and women, and they actually donate their services and see these patients pro bono at no cost to the patient. And in our network we have physicians, hospitals, social services, surgical centers, imaging centers, laboratories, anything you can imagine that has to do with healthcare and taking care of breast cancer patients.
I've been involved in breast reconstruction for decades, and over a period of years I saw a number of patients who had what should have been treatable breast cancer, but their treatment was delayed because they didn't have insurance and they didn't have the resources to get care even after they found a lump or had an abnormal mammogram. So having cared for these patients and taken them through what was a very complicated treatment process, I realized that we had to try to find a way to treat them that would offer care when their disease was in an earlier stage, when they found a lump or had an abnormal mammogram. So having looked around and realizing that there wasn't a program like that, I decided to start Gateway to Hope.
It's a simple concept, and it should be portable to most any city. I mean, it's basically physicians donating their time, ancillary services each donating part, hospitals donating part, the drug companies donating part. So if everybody pitches in and does a little, it should be totally portable. We've been out there contacting other groups, talking to physicians, explaining to them, what the concept is, and without a doubt, I mean, everybody's, oh yeah, sign me up, I'll do my part. It's just been very well received.
I called Gateway to Hope. I spoke with Chris. I gave her my story, and oh my goodness, she was such an angel. She told me that she would give my case to Dr. Kaplan. She got with Dr. Kaplan, and then she got back with me within a couple of days, and she told me that Dr. Kaplan would take the case. Oh my God. I was so relieved because it took me 2 months before I found someone that would help me.
When they make the call to me and they're asking me to arrange the care, I feel like there's a significant amount of listening that has to be done first. They want to tell their story, and it helps me gain an insight into their life. I find oftentimes they inspire me because they are not only facing now the difficulty of breast cancer treatments, but they're also caring for their families, they're continuing to work, and most notably, they're continuing to face the stress of inadequate insurance coverage and also financial uncertainty.
One just assumes that some major catastrophe happens, that you've been paying for insurance for forever and you'll be covered. But that's not the case, not my case. Gateway to Hope has helped me with chemotherapy, the cost, which is phenomenal, and then I'll have radiation after my surgery, and they'll be covering my surgery as well, and they even helped me get a wig. was tough. The chemo was tough. I mean, it affected obviously your hair and eyelashes and eyebrows, and you're exhausted all the time. But it all worked. I really would know where I would be if I would even be able to fight the breast cancer. I might not see my son graduate from high school. So it's been a blessing.
I'm a private duty nurse, and the lady I was working for, she passed away at the age of 93. And so once she passed, I said, you know what, let me look into what's going on with myself. Now it's time for me to worry about me. And that's when I went and I had a biopsy done, and I was told that it was breast cancer. So, you know, then my world turned totally upside down, and it's like, okay, what are we gonna do about this? You just lost your job. You know, you live alone. You have no insurance, no money saved up. What am I gonna do? And Gateway to Hope came in and rescued me. They really did. They really did. I mean, setting me up with the doctors for my treatment. They give me gas cards so I can get back and forth from treatment, and it's just been a blessing. It really has.
But with Dr. Shu, she sat me down with my friend. She opened up the Cancer Society booklet and said, here's what you have. And she said, and they recommend, and I agree with them, that you need a mastectomy. And I just, you know, I kind of spaced out. And I looked at my friend and I said, you need to start listening now, because I don't know if I can hear anymore. But it was within a week. I had the mastectomy, and Dr. Gurley came in and started the reconstruction. And I guess I don't know, I was still pretty much in shock, I think, through most of it. And then I went back into Dr. Shu, and she said, I don't think you're going to have to do chemo. And I went, yes! I went in to see Dr. Copeland, and a week later, and she said, yeah. And I'm like, oh. So then that's when I started bawling. But I did 6 bouts of chemo. I did lose all my hair, and that was the most traumatic out of all of it, you know, and I did get sick a little bit, but, you know, all in all, I came through. I'm still alive. I still can help raise my little girls.
Day to day, we know we help, you know, and it's sort of your job, but it's more than your job. But day to day, you're helping. But this is a step beyond that.
Dr. Macklin, I really like him a lot, because not too many doctors out there will give you their cell phone number. And he told me to call him anytime that I needed to call him.
They are hardworking women. The reason why they are stuck in between is because they get up in the morning, they go to work. They unfortunately have lost their health insurance or don't have health insurance for one reason or another. So they are hardworking individuals who were stricken with you know, just a huge stroke of bad luck. And we can help them. You know, so for the most part, these are, you know, wonderful, salt-of-the-earth individuals who are very, very, very grateful for, you know, everything we can do to help them.
Since I've worked in jobs that haven't paid as a Sister of Loretto, I didn't have insurance, and my physician suggested that I look to Gateway to Hope for assistance, because I didn't know how I'd possibly pay for the chemotherapy that would involve thousands of dollars. I contacted Gateway to Hope, talked with Chris and Fran and others there, and I followed with a financial report, a psychological examination, and then they actually took care of. I was very concerned about. I was worried about the finances, and Gateway to Hope made it very simple for me. It was such a relief at a time when I was having a lot of invasive things happening in my body. It was such a relief emotionally to not have to be worrying about how to pay for this chemotherapy.
Our staff is really incredible. They're very unique, and they were truly the pioneers. What we started with was a concept, and we knew what the goal was. We really didn't know how we would reach it. So their jobs have morphed constantly. And what they've done is figured out when they need to zig, and that's what they do. And when they need to zag, they do that as well. So they constantly are changing their focus to adjust to the needs of the patients and the patient demographic, which changes constantly for us. So it really is a truly remarkable group. And I think if starting out a few years ago, if they had ever envisioned a program being successful, I don't think they would have ever envisioned it being as successful as it's proven to be.
I decided to call Gateway to Hope, and I spoke to Fran Jackson. She invited me over right away, and we sat down, we discussed things, and I just couldn't believe it. I just thought it was fantastic that even though I was going through a hard time in trying to grasp the idea that I had cancer, I definitely had a solution immediately given to me. You know, I don't know, it was incredible. Like, God, you know, here it is. This is for you.
A big, big thank you to Gateway to Hope. I mean, I wouldn't be here if it was not for them. And the people there have just been wonderful, and I thank them so much for giving me, you know, the gift of life. I mean, they've, you know, helped me through this whole journey. And if it wasn't for them, I don't know where I would be today, truly.
Most of my customers at work told me about this Gateway to Hope. They knew I had breast cancer and that my insurance would cover the radiation or chemo or any of it. I felt helpless, hopeless, angry, real angry. It was bad enough having breast cancer, but then having to worry about a lingering death and going broke, dying with nothing. And I didn't want to put my grandchildren through that or my son. It was horrible. Horrible, desperate. Gateway to Hope, whew. I mean, what a name. That's exactly what it is, Gateway to Hope. It saved my life.
We need organizations like Gateway to Hope that are going to help these people, because it's not anybody's fault. You know, I mean, in some ways, I guess I felt it was, you know, my fault that I let my insurance lapse, but it wasn't my fault. You know, I wasn't doing anything wrong. I was working, you know, paying bills, putting my daughter through college, doing all the, you know, driving a car, keeping car insurance, doing all those things. But, you know, you have to make choices. And, you know, a lot of people choose not to have health insurance and pray and hope for the best, which is what I did. And that doesn't always work, obviously. Things happen. And organizations like Gateway to Hope are there to help.
We had a haircutting party, and we had a head shaving party. So all 4 of my kids participated. Pretty frightening to have a 2-year-old around your head with scissors, but we had fun. And then the older kids got the shavers out and shaved it. And then my 23-year-old son turned clippers around and shaved his head. Because he said it wasn't right that I was bald. And I mean, like I said, the ladies at Gateway to Hope gave great suggestions on how to deal with all of it, you know, making it fun. And they got my son into a support group, a 6-year-old, for other little kids at Missouri Baptist to deal with when mom has cancer, so he could talk about it. They're not just there for you, they're there for everybody. They're there for the whole family.
When we envisioned the Gateway to Hope program, we always knew that there would be a need. We just didn't know the need would be this great. When we envisioned the success stories that we would help write, we didn't expect them to be as successful as they've proven to be. So I think we underestimated the impact that we would have on our patients' lives. And I think we also underestimated the impact that they would have on ours.